Hey everyone, it's Dr. Wada here. I am a quadruple board certified pediatric, adult, allergy, immunology, lifestyle medicine physician. I also happen to be a life coach, and I have been helping people with allergies, asthma, autoimmunity, mast cell disorders, all things glitching immune systems, take control of their health for almost 15 years. As someone with a misbehaving immune system myself, I live with Sjogren's and dysautonomia. I also am a former food allergy mom. I understand these challenges firsthand. Today, we are going to explore a fascinating connection, the link between our connective tissues and immune system dysfunction. In particular, we're going to focus in on hypermobility. Those folks who you remember from grade school, they could do all the fun party tricks with putting their fingers back, doing the splits. They are those bendy individuals, or as Dr. Linda Bluestein calls them, bendy bodies, by her podcast of the same name. It's an incredible resource. If you don't follow and listen already, you need to head over there and stay tuned because we just recorded a great episode. They'll be coming out sometime soon. All right, so hypermobility, it's when your joints are extra bendy. And this might seem like a harmless quirk, but for some, it comes with a whole host of challenges, from chronic pain to a wonky immune system. Immune dysfunction, on the other hand, means that your body's defense system isn't working as effectively or efficiently as it should. So this can lead to increased infections, autoimmune issues, and even with problems with how your body heals. Let's dive into hypermobility a bit more. When does bendy become a problem? Hypermobility syndromes are conditions that affect your connective tissues, the stuff that holds your body together. I had a patient lovingly refer to it as their meat suit, which I think was very illustrative of what our connective tissues are. It provides structure and support. And there is a range of hypermobility. This is what we call hypermobility spectrum disorder. And across the spectrum, we can see various types of connective tissue disorders. One that has been getting increased discussion in recent years is Hypermobile Ehlers-Danlos Syndrome, hEDS. Common signs and symptoms include extra flexible joints, so double jointedness, often a clue, clicky or cracky joints, sometimes they are accompanied by pain, frequent sprains or dislocations, especially of troublesome knees or ankles, and soft, velvety skin that can bruise or scar easily. So what is this link between the immune system and hypermobility? Let's dive in a bit deeper. Immune dysfunction is a broad or an umbrella term, and it encompasses a wide range of conditions from primary immune deficiencies, things that can result in low immunoglobulin levels like IgG, IgA, IgM. Those are those antibody proteins that help protect us and help provide our immune system memory to the things we fought off before or the vaccines we received. Also can go along with complement deficiencies. Complement is another type of immune system protein that helps our body respond to infections. We also can see hyperreactive mast cells, so mast cell activation. And we've talked about that quite a bit on this channel already, and I'm sure we'll continue to in the future. We'll link to some of those in the show notes below. So let's connect the dots. A study in 2021 by Dr. Ann Maitland, Brock, and colleagues shed some light on this hypermobility immune connection. They discovered a striking overlap. A significant number of people with hypermobility also had signs of either mast cell activation and or lower immunoglobulin levels. This suggests these seemingly two separate issues might be more interconnected than we previously thought. In their study, 46% of those suspected of having mast cell activation disease actually had a diagnosis of mast cell activation disease. And 43% of that entire group also had an immunoglobulin deficiency. The why? How inflammation damages connective tissues. Chronic inflammation that persistent low-grade immune response can gradually break down connective tissues, like a slow, steady drip wearing away at a stone. This process, along with imbalances in our extracellular matrix or our connective tissues, which is that intricate web that holds everything together, contributes to the pain, joint instability, and other challenges we often associate with hypermobility. So how can we get some answers? For diagnosis and testing, if you suspect that you have hypermobility, your doctor might use a few tools. One is they may calculate what's called a Beighton score. It's a simple assessment, go down a checklist to check for joint flexibility. Also, we'll have your medical history reviewed and a physical exam. When we're thinking about evaluating further for immune dysfunction, in addition to getting your infection history and how you did with your childhood vaccines and growth, it is important for us to check certain blood levels. In particular, we often will check immunoglobulin levels. Those are those immune system proteins I talked about earlier, IgA, IgG, IgM. And we will also check specific types of IgG, which are called vaccine antibody titers. This reveals how well your body has responded to and kept memory from vaccines that you have been administered over time. So in particular, we often will look for memory to your tetanus vaccine, sometimes diphtheria vaccine, and often to the strep pneumonia vaccine. If those levels are a bit low, and it has been some period of time since your last booster shot, often we will recommend getting boosted and rechecking those titers about 4 to 6 weeks after the booster. This then gives the immune system ample time to mount a response if it's able to, and show us that it can do its thing. And if it can't, that's also very telling. Often we will also check complement levels, and this typically is either C3, C4, or a more comprehensive test called a CH50, which checks for all the types of complement and ensures that they are working well together. Managing hypermobility usually involves a team effort. That's why I love collaborating with my friends and colleagues at Prism Joint and Spine. They really take a full body approach and whole human approach to care and hypermobility. But often this includes physical and occupational therapy to strengthen, to mobilize, to stabilize. Pain management, finding safe and effective ways to manage pain is crucial. You want your body to feel safe and comfortable in itself. Collaborative approach with your healthcare provider is really essential here as well. In patient education, knowledge is power. Understanding your body and learning healthy movement patterns can make a world of difference. Now, treatment for immune dysfunction depends on the specific type of deficiency, which might include immunoglobulin replacement therapy, sometimes known as IVIG or subcutaneous IgG, or managing mast cell activation disease symptoms. If there is an autoimmune condition going on, that can require additional workup and treatment as well. If you're living with hypermobility, it's about more than just your joints. Living with hypermobility for many people means dealing with chronic pain, fatigue, and those unexpected flares. It's challenging, but it's really great to know you're not alone. Building a strong support network, prioritizing self-care, and finding ways to manage stress are all essential. And really putting it all together and taking a holistic approach is really important. When we understand the connection between hypermobility and immune dysfunction, can empower us to address both aspects of this complicated puzzle. It's about collaborating with your healthcare team, your allergist, immunologist, your rheumatologist, your physical therapist, your physical medicine rehab doc, to find a plan that works specifically for you. For those of you wanting to learn more about Hypermobile Ehlers-Danlos Syndrome, I highly recommend checking out my podcast episode with Dr. Sarah Cohen-Solomon, my new colleague at Prism, a specialist in pediatric and adolescent medicine, whose whole practice is focused around hypermobility syndromes. We dive deep into the world of hypermobile EDS, explore ways to find compassionate care, and discuss the importance of appropriate accommodations, especially for students. I'll link to that episode in the description below. Take charge of your health. If you are concerned about hypermobility or immune dysfunction, schedule a visit with your doctor. It's time to find answers, create a personalized strategy, and thrive. Be sure to join my free Facebook group, the Becoming Immune Confident Community, a safe and supportive space to connect with other autoimmune, hypermobile, mast cell, all the glitchy immune systems and connective tissue disorders. We are all in that space coming together. And to prepare for your next doctor's visit, download my free immune system disorders pre-appointment workbook. Yeah, I know the name of it is a little clunky, but what's in it is super helpful and it's going to help you get the most out of that next visit you have with your healthcare team. It's packed with tips and questions to help you make the most of that appointment. I'll put it in the links in the description below. And if you haven't heard already, I am getting ready to launch my new telehealth practice in collaboration with Prism Joint and Spine. If you aren't on the wait list already, you should hop over and put your name on it. In part, this is helping me understand where you're coming from so that I know the places I should be getting my medical license so that I can reach you in the comfort and safety of your own home or office to help you on your journey to becoming immune confident. I can't wait to launch my practice later this winter and really help to work with you to personalize a roadmap to help you move the dial on your immune system health and healing. Be sure to subscribe for more videos just like this one, where we'll explore those mind-body connections and those hidden health issues often missed or misunderstood. What questions do you have about hypermobility and immune dysfunction? Share your thoughts and experiences in the comments below, and I look forward to connecting with you. Until next time.